G'day, my name is Brendan and I will be presenting a slideshow today for EHR525 Assessment Item 2, Part B, the case study of Mr. Andrew Green, a chronic post-hemiparetic stroke patient with depression. Starting the presentation here with the 3 exercise intervention goals. We've got goal 1 here, which is improving Berg balance scale scores to greater than 45. Mr. Green's initial Berg balance scale was 36, which indicates poor balance, which has a high risk of morbidity and mortality due to a risk of increase of falls and fractures. Also, this may be impairing Mr. Green's functional capacity, mobility, and ambulation, and as such improving this is essential towards his rehabilitation and independence. A score of greater than 45 indicates a reduced risk of falls and subsequently fractures, and improving his balance will also improve the functional capacity, mobility, and ambulation of Mr. Green. Our second goal here is improving muscular strength of the hemiparetic stroke side. Mr. Green's initial handheld odometer assessment indicated substantially impaired strength due to his hemiparetic stroke, which can impact his independence, quality of life, mortality, and morbidity, whilst also potentially contributing to his shoulder pain. Improving his strength will not only assist in mitigating many of the risks, but also improving aspects such as ambulation and functional capacity. Our third and final goal is reducing his timed up and go time to less than 20 seconds. His initial timed up and go was 26 seconds, which indicates poor ambulation ability. Improving Mr. Green's ambulation is crucial to his independence and rehabilitation, and a decrease of 6 seconds would suggest Andrew is safe to ambulate independently. Notably, none of the goals addressed Mr. Green's mental health concerns, but engaging in a structured exercise program does improve clinical depression scores, so all 3 goals will address the mental health concerns as well. Now, to start off the 8-week program here, just going to go over the macro and micro cycles. The macro cycle here is just to indicate the testing frequency on week 1 and week 8. And the micro cycle here is just taking into consideration Mr. Green's capacity for exercise and depression. It's taking a rather minimal approach to the program while still following the ACSM guidelines with frequent rests and interspersed with his home exercise programming in a single day designated to an in-clinic session. And following here, just going over the structure of the in-clinic sessions, we're starting with a warm-up just to prevent injury and gradually prepare the body for exercise, followed by the aerobic balance and resistance exercises, and then finishing up with a cool down to return the body to a pre-exercise level and reduce potential soreness, totaling for about 40 to 50 minutes per session. And now just to detail the fit principles of the exercise prescription. Overall, looking at 4 sessions per week for all the exercise types, keeping that intensity low or moderate to low to consider Mr. Green's depression and functional capacity, and all the times are set to the guidelines provided by the ACSM or relevant literature. Notably here, focusing on Mr. Green's goals of independence and improving functional capacity and ambulation, we have full body or machine exercises for resistance, treadmill or walking based exercises for aerobic, and dual task based balance exercises to address neuroplasticity and neuroprotection aspects of stroke rehabilitation care. Following on with the 8-week program, we have some quick examples of the exercises Mr. Green will perform. Starting off with the aerobic exercises, considering Mr. Green's functional capacity and depression, they've been broken up into blocks to prevent excessive fatigue or overexertion. So he'd be performing treadmill walking for 3 sets of 5 minutes without the assistance of walking aids or rails, and progressing to an increase in the duration of the intervals. However, if required, the rails are an available option. Notably here, the main benefit we're looking to gain is improvements in functional capacity and ambulation. Having Mr. Green walk at a steady pace will encourage neuroplasticity and assist with improving his walking whilst developing his capacity. With the potential concerns of aphasia and apathy, we're ensuring that regular check-ins are made with Mr. Green to ensure that he's comfortable and willing to continue exercise. Additionally, evidence does suggest that background music encourages neuroprotection and neuroplasticity, so this will also be included in the program. Moving on to balance pad exercises, Mr. Green will be performing a dual task balance pad exercise, and this is done as incorporating dual task exercises into balance movements, improves balance scores and mobility in chronic post-stroke patients. He'll be standing with his feet together on a balance pad while swaying a cup from side to side for 3 sets of 30 seconds, similar to the picture here on the slide. And given the necessity, Mr. Green is given the option to remove the balance pad to reduce the strain on the muscles and also progress the exercise to a semi or full tandem stance as Mr. Green becomes more comfortable with the exercise. Notably, Mr. Green will be performing the exercise in front of a mirror, which is going to provide visual feedback which can assist with encouraging the neuroplasticity aspect of the balance task. And also Mr. Green is still at risk of fall, so he'll be performing the exercise with hip pads as a safety precaution. Finally here, we're just going to have a look at some lower and upper body resistance exercises Mr. Green will perform. Starting with the lower body, we've got to sit to stand for 3 sets of 10 repetitions and eventually progressing to a body weight double leg half squat. The sit to stand was chosen as it reflects the functional capacity aspects of Mr. Green's activities of daily living. Our major consideration here is poor balance strength and mobility, so given the requirement, Mr. Green is permitted a support such as rail or wall to assist with the movement. With the upper body exercises, we've got a single arm seated dumbbell shoulder press. This exercise is focused on improving Mr. Green's shoulder pain, as his handheld dynamometer assessment indicates that it's likely due to muscular weakness of the deltoids. And again, we've got options here for regressions of a machine shoulder press and a progression of a standing shoulder press. Our major considerations here are also shoulder pain and weakness. With the high risk of apathy too, we've got frequent check-ins being made with using pain scales to ensure Mr. Green is comfortable and relatively pain-free during the exercise. To finish up our 8-week program, just going to go over the home exercise program. We have 4 aerobic, balance and resistance exercises to be performed, keeping the prescription quantity and intensity low as to not overwhelm Mr. Green. Firstly, with aerobic exercise, we have 3 5-minute intervals of walking anytime throughout the day with or without a walking aid. We next have our balance exercises of just semi or tandem stance holds for 3 sets of 30 seconds, also providing the option for Mr. Green to perform the exercises with his eyes open or closed, or with additional supports depending on Mr. Green's confidence to increase or decrease the difficulty if required. And finally, just 2 resistance exercises focusing on improving upper and lower body functional capacity with sit to stands and lateral raise holds. And to finish up the presentation here, just going over the benefits of multidisciplinary care. Firstly, we have exercise physiology, which we've detailed the benefits of throughout the presentation, but it's worth considering the benefits of a general practitioner, which can provide education on symptoms and care, referrals to other health professionals, and the management of medication in aspects of that exercise cannot assist with. Additionally, it's worth considering how occupational therapy can assist Mr. Green in the return to a pre-stroke lifestyle with functional capacity assessments, upper extremity rehabilitation and home assessment evaluations there to make sure that Mr. Green is safe and comfortable when he eventually returns home. And finally, though returning to a pre-stroke lifestyle may alleviate Mr. Green's concerns with depression, it's worth considering the involvement of psychological care, which can provide individual therapy, coping strategies, or education to overall assist with Mr. Green's mental health concerns.